Medical Dialogues. I'm Anshika Mishra. Today we'll talk about 1 week FDG PET CT predicts treatment response in advanced melanoma. Cancer immunotherapy has helped transform the standard of care for many malignancies, but not all patients respond to therapy and the treatment can cause severe events. Typically, immunotherapy patients are imaged around 3 months after starting treatment to monitor their progress. The research team, led by Michael D. Farwell, an associate professor of radiology at the Hospital of the University of Pennsylvania, hypothesized that by using F-fluorodeoxyglucose, that is the FDG PET CT, which is one of the most common and readily available ways to test for cancer, patients could experience metabolic changes in tumors after a week on immunotherapy. The study is published in Clinical Cancer Research, a journal of the American Association for Cancer Research. To test their hypothesis, the researchers recruited 21 patients with advanced melanoma scheduled to initiate pembrolizumab. As part of the trial, patients were required to have at least one measurable lesion and could not have received previous anti-PD-1 or anti-PD-L1 therapies. FDG or PET CT imaging was performed on each patient within 4 weeks prior to the start of therapy and then at about 1 week after the first dose of pembrolizumab.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
FDG activity for each lesions were measured using the maximum standardized uptake value. For the purposes of the study, the MF was defined as a greater than 70% increase in tumor standardized uptake value and an MR as a greater than 30% decrease in tumor standardized uptake value. An MF or MR was identified in 55% of the patients who responded to treatment, that is 6 out of 11, and 0% in patients who did not respond, that is 0 out of 8. An MF or MR also correlated with longer survival, with 83% of the MF-MR group seeing an overall survival of 3 years compared to 62% in the group with stable metabolism. The researchers concluded that since tumor passed through a stable metabolism phase between MF and MR responses, it will be a key to identify if a tumor with stable metabolism is in fact responding, but is it in between reaction phases, and that some potential solution for that include layering on companion studies such as blood test, a CD8 PET scan, or a serial FDG PET CT imaging to better plot out the changes over time. While the results need to be validated, this has the potential to be broadly applicable and offer physicians the ability to de-escalate therapy or avoid surgery in patients who are responding, identify non-responders who may need an escalation of therapy, and to use in phase 1 clinical trial to test if a therapy is working, Farwell explained. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.